That's a great answer. And that actually kind of walks us to where I wanted to begin relative to like the pre-work. And let's say that you are that person walking in. You are you, Jack, who walked in and you've got those binders for somebody who's new to the field. And Taylor, you actually just gave a couple of really good examples. And I would also say, if you have not worked in healthcare facilities management and maybe you're just finding yourself in it now, or you're considering it, Taylor's words, I think, are really true. I don't know that there's a field where people are more willing to help you or answer your questions, or
Absolutely.
you can reach out to folks. How do you begin? How do you make the vast simple? How do you make it so you don't feel overwhelmed? Is there a way? What do you do? Sorry.
But yeah, I'll take a shot at that. So, I think this is going to go back to, and I think Taylor will, she already has alluded to this, is your resources around you. I mean, to make the vast simple, you have to have somebody that come alongside you, or you got to reach out to people. You got to be humble enough to reach out and say, hey, I don't know what I don't know. Can you give me a macro? And you start with the macro. And I think, Taylor, you said you got this from your study with the CHFM, but you have to kind of like go from 10,000 feet, get an idea of what this is all about. And then you start working your way down into the minutia. And you'll get better and better at the details as you go, but you have to have someone else. And you're going to have almost every hospital system has a process in place for managing their documentation. So you're not starting at zero. If you were starting at zero, you're going to have a big problem. To try to understand the system that is currently in place. Everybody has, because you would not exist in healthcare today if you didn't have a system, didn't have a process.
Can I ask you a question on? Can I ask you a question on that, Jack? And I still hear, and I don't know if people, you hear things all the time. You don't always know if people are making things up, or maybe they're exaggerating, because a lot of people do have, like, a lot of people will exaggerate. But do you still hear stories? Because I still hear stories where so and so did nothing. Like, there is nothing in place relative to documentation. She hasn't done anything, but they continue to get by every 3 years. So does that still exist out there?
Probably, like you said, it's probably an exaggeration. And from maybe they're looking at from the perspective of where you should be.
Yep.
And you have done very little.
Yeah.
There's almost no organization that I've been to a lot of hospitals. I've seen a lot of things. I haven't seen anyone not do nothing. People do things poorly, and maybe things they're doing testing and inspection, and no one's really watching over the process. But we have a lot of good vendors out there. They've been there last year. They want to come back and test this year. Right. They did a try load bank for you 3 years ago. They want to come back and do another one. Some of that stuff it's self-perpetuating in a way. But I think that's probably exaggerated. What do you think, Taylor?
So I started, not to throw them under the bus, but I started at Children's Health in 2015. They had a generator binder, and that was it.
Wow. That was it.
I don't know how they got through survey before that. I really don't know.
Yeah, I mean, I kind of hear that sometimes, and you just scratch your head. What did they do, or how did they? I mean, God bless. I'm not even going to tell you the hospital, but the director unfortunately passed away. New guy came in. He's like, we don't have anything. And this is Peter Martin. If you or your organization is interested in advertising or partnering with the Healthcare Facilities Network, including sponsoring content, then please email me using the barcode in the lower right of your screen. From the trades level to the vice president level, from planning, design, construction, project management, compliance, safety, and security, the Healthcare Facilities Network reaches FM people where FM people. So that's why I asked that, because that's why I asked. Sorry, God bless. But anyway, sorry, I just jumped in on you there, Jack, because I wanted to see what you guys are seeing out there.
I guess we can both only talk about our own experiences. I haven't seen anything that bad. I had seen a situation where, people bring me a box of stuff. And there's some stuff there.
Yeah, so maybe that's what.
Think about all those regulatory agencies that look at. If you're accredited, you're going to have a survey once a year, once every 3 years. CMS can come anytime they want. If you're taking federal money, you can get state fire marshal, and
Yeah.
the company goes a little bit, it can be all over the place. They may look very deep into stuff, and they may look very superficially at your documentation and so forth. But I can't imagine today that somebody can have nothing and talk. Maybe they're a really good fast talker. I don't know.
Well, and it could be that box of documentation that's just passed on. I don't know. Like I said, I haven't seen it myself, but I certainly hear about it enough to think there's got to be some validity to it. So I knocked you completely off making the VAS simple with that question and went down that. But so you were talking about process, Jack, and going in and how to begin.
Well, and it depends on where you're at. So most hospitals today are accredited with somebody else, with some accrediting organization, a deemed authority, like the Joint Commission, the DNV, or somebody like that. I think that's probably in the 99% area of hospitals today. So, you may want to frame up your process around your accreditation requirements. If you're Joint Commission, you're going to lay out your binders and your process along their elements of performance and their standards, which are pretty straightforward in many ways, at least setting up the process. And it's not unusual at all for me to walk into a hospital and ask for records and see, things arranged in their inspection, testing, and maintenance of fire alarm systems, suppression equipment, alarm systems, all in a sequential way that follows that system. You have to be able to wrap around the process yourself if you're going to put it in front of somebody else, right? So without that process, man, I feel bad for you because your life is not going to go well. But you got to have a process of paperwork of how you're managing documents. When a vendor sets something on your desk or sends you something electronically, what are you going to do with it? When you got an electronic process, and Taylor can speak to this probably better than I, you got to have a place to put all that stuff, and you got to have an internal checklist saying, this month's work was done, this week's generator inspection was done, and so you kind of have an eyeball on that to say, I am in pace and on pace with my regulatory requirements. And you don't want to get buried by that stuff.
Let's talk about process, because that's probably the word that's been used the most during our discussion. What is a process? Sorry if that's a little vague, but I mean, it seems like it's the key.
For sure. To me, it means routine. And I think if you've worked in healthcare facilities, you'll realize that, the technicians especially, they want a routine. They follow the same routine every month, every week. So we set up those routines. Every third Wednesday of the month, we do our generator test. After the generator test, they bring me the documentation and we go over it. We look at any failures or any re-inspections we have to do. We do the same thing every month. And then every May, we do our load banks. And every, December, we do our fire doors. It's a routine. And we don't stray from the routine, and we do the same process every single year. So just setting up those expectations, and we just wrote them down, and we have our PM set up in our work order system, so they know every December they're going to get that work order to go do their fire door inspections, and just we follow the same process, and that keeps us in line with our dates, and they know what they're supposed to do. So that's what it means to me.
How long does it take to get that process, the buy-in, and then just the consistency to make sure that people aren't going around that process on you?
It's probably about a year, I would say. And I really find that, I've developed a really good relationship with all of our technicians. They all know me, I know them. So that process was actually a little bit easier, thinking about other people in the hospital going and doing whatever they want, especially people who decide to change the use of rooms and don't tell anyone.
It's a great one.
That's a little harder because they don't know me. They don't know what engineering does. They don't know that, we have to have pressure requirements for this room.
It's just a room.
It's just a room, and they want to make it a storage room, and they don't understand why that's a big deal.
Yeah.
That's more challenging. And we've sent out announcements, and we have a process to change rooms, and we have a form you have to fill out, but there's still ways around that.
Yeah.
The only thing I can say to that is you have to get out and walk your hospital. We do so much rounding where we go look inside those rooms and see if this is really still an office, or is it now a storage room, or is it now, sole utility or whatever. You have to know your hospital. You have to get out and walk around it. And, when you find those rooms, educate that staff and say, hey, we can't make this room. We got to change it back. Here's why. And hopefully they, learn from that. But it's, you can set up those processes, but people are always going to find a way to slip through, and you just have to have a process to find those. So
Yeah, a process for the process, because it's really easy to get stuck or stay in an office and try to learn everything, especially relative compliance. You're walking in, you got all these binders, but how do you balance that with the visibility to create the credibility and for people to know who you are and to help push that process? How do you balance that relationship?
Well, I think that's born out of your own personal dedication, integrity, and those kinds of things. And there's no replacement for, like Taylor said, for being out on the floors, in the area, in the environment, connecting with line staff, connecting with managers, directors, and they will come to know you. You'll get to know them. It's about developing relationships. And once you provide in their eyes that credibility as a go-to person that understands some of the nuances of what you can and can't do with rooms, for example, they will come to you eventually instead of just acting alone. But a lot of that is building relationships, gaining understanding, and building credibility with the people that you work with.
Jack, what is and I'm asking you because your experience is a little bit more, but do you recall is there a process that sticks out to you? I feel like sometimes I tend to focus on the negative as opposed to the positive, so that's probably a problem with me. But is there, through your 30 years of doing this, is there a process that stands out to you that was just it floored you? It was like, I can't believe this person is doing that. Anything in your memory?
Jesus, probably once
that would be a good lesson.
Well, there's plenty of examples of poor processes or bad processes. You can see that all the time. I guess it's more important to establish what is a good process. And again, I think Taylor alluded to that. When you do a test, when you do an inspection, whether it's an in-house or a vendor, example she gave was the generator test and inspection. So if you have a process around that, when you complete the test, whether it's a vendor or it's in-house staff, at the completion of that test, if they find a problem with it, number one, again, that's a credibility too with your technicians or your vendor. Are they doing a thorough process? I don't need to be informed of every step, but I do need to know when something doesn't do what it should. When a generator doesn't perform the way it should, when the batteries don't perform the way they should, you don't just stick that thing in my inbox, or you don't just send me something electronically. You make me aware of a problem, and that's a relationship you build with these people. Like, listen, I'm responsible for this equipment when it fails, because the minute that fails, I have to start thinking about remediation. I have to start thinking about, if it's life safety equipment, I got to start thinking about creating an intermediate life safety measure. And even if I'm not Joint Commission, I got to start thinking about mitigation for that design equipment that isn't functioning the way it should. So if I'm not mitigating that risk right now, and maybe I'm inviting a vendor in to give a price to me to fix something, and then I got to close that loop all the way through. And when I'm all done and I've remedied that problem, I can trace my paperwork from inspection, test, to repair, replace, and re-inspect. And once I got that, now I'm cradle to grave. That's the details. If you get lost in that process of those details anywhere in there, you might have did everything, but you didn't retest it. Now you got an open spot to get hung up on, or you may have replaced everything. You may have sent the PO. I sent a PO out to them. I know they fixed it. They never sent me anything back. You got a void in your program. So that's the process. You got to look for where I've got roadblocks in my processes.
I would like to talk about vendor management because it's just so critical. Even everything from when they walk into your hospital, filling out those permits, for above whatever it happens to be. So I mean, as you know, you could spend hours on just the vendor management portion of it. But
Vendor management is difficult. Just kind of going back to the processes we've set up. I think about we contract out our fire door inspections. Um, One thing that has really helped us is we have an initial call before we begin the inspection, and I lay out my expectations. Um, and another
is that with
really
all
kind of
vendors or
landmine.
most vendors there, Taylor?
Most vendors, fire door is so complicated
Yeah,
because,
yeah.
like Jack mentioned, there's so many ILSMs you have to do. But educating them on what I need because they don't know what an ILSM is. They don't know, what the Joint Commission requirements are. So I have to tell them, I have to educate them, and then, as they start their inspection every single day, we have a call at the end of the day so they can tell me what failures they found, so I can immediately put in those ILSMs if I need to. That was a challenge to get that set up because the vendor doesn't think it's necessary. They're like, oh, these are easy. We're just doing fire doors, but it's a big deal.
Yep.
So I would, if you can, I would use the same vendor every year because I've set up a really good relationship with my vendor who does our fire door inspections. It's the same technicians, it's the same account manager. They know what I want. Um, and, I know the quality of work that I'm going to get. So I don't know if that answered the question, but that's a good process that I've set up.
It's whatever.
You know what? I'm going
Whatever
to
you
add
find.
that just a bit. Those are very insightful answer. When it comes to vendor management, Taylor mentioned they know what I want, and to me that's a key piece. Sometimes when you're working for a large organization, there's almost a templated program that you buy from a vendor, and sometimes they lose sight that each hospital you are the customer. Yes, the organization may be the customer, but if I'm responsible for what you are doing, I am your customer, and it matters what I need and what I require from you. Um, you have to keep that first and foremost. You do not have to accept them. You may have a large organization. I could quickly mention names, but it wouldn't do any good because we deal with a lot of vendors. We do not have to put up with a technician that is subpar, for example, or does not communicate well with us, doesn't walk into our hospital and sign in, does not follow our above ceiling process, uh, does not provide an executive summary for us in the documents, or is unclear, or their handwriting I can't read. We don't have to put up with that stuff just because there's a master service agreement with our large organization. And so holding people accountable, even when you don't feel like you have the expertise, you may be a young manager new to this industry, but you still have to be comfortable with what they're doing at the end of the day. And it's okay to push back and hold them responsible. And if you got somebody in your building you don't think is performing as they should, then you may have some steps to climb to deal with that person in your organizationally, but no one should expect subpar work. And we have a lot of great vendors. I don't want to discount the professional of our vendors. We have a lot of good people, but we're more and more reliant on those folks because there's a lot of people that don't have the numbers of staff they had 5 years ago.
Yeah.
So depending on good vendors is crucial to your success as a facility leader.
Yeah, and I think I've been on this side now for like 10 years, so it's been a while. But I remember back even 10 years ago, it was hard to get. You were always looking for a vendor, and it's probably why you want to use your experienced vendors there, Taylor, who could give you a team where they had worked in a hospital, because it's such a transition. So I imagine it's even worse these days, right? I mean, you're out there trying to find vendors, Taylor. I'm not, but they're dealing with the same issues you are. They can't find people either. And so, finding people and then educating them to the hospital environment is a job.
Yes.
That's absolutely true. And we ran into another challenge in the past couple years where children's required the COVID vaccine.
Wow. Yeah.
And I actually lost my medical gas vendor that I had used for years because they refused to get vaccinated. And so I had to go find a new one, and that that was really difficult. Medical gas, especially if you're watching and you're a medical gas vendor, please come to Dallas.
Yeah, that's a big one to lose.
Yes.
You
Wow.
know, one thing I'll add, Peter, is these people become vital to our organizations, our hospitals.
Yeah,
They're almost like your own staff in some ways,
they
and the
are.
level of trust. And it's all about trust. You get somebody that's competent and trustworthy, your communication will be minor, and you'll feel good about it.
Yeah.
Because really, when you're in facilities management, you got 3 or 4 balls in the air at all times. So if you got somebody you can trust, walks in your hospital as a vendor, does not do anything untoward, and knows how to deal with the managers, the directors, the hospital environment, come in, do their work, get it done. You don't have to worry about it, and they'll provide you all the paperwork as required. That's a damn good vendor, and one that you'll be proud to have in your establishment.
Yeah. Yeah. So as we wrap up episode 1, pre-work, compliance pre-work, anything Taylor or Jack that we haven't touched on relative to this small beginning portion that you think is important for folks to know? And again, I'm thinking more of the person who's just starting out. Even experienced people are always learning something. Anything we didn't touch on that you'd like to bring up before we close?
Yeah, I would say, I know we touched on rounding a little bit, but I would say if you're just starting out, spend a couple weeks, go hang out with each technician, because they'll tell you what they do. They'll be doing their room pressure testing, and they'll say, oh, we have to do this, and um, you can take that and say, okay, why do we have to go do this? Why are they doing this every day? But spend time with them. They'll tell you, the areas you need to focus on, um, and then you can go back and learn why you have to do that and make sure we're doing it the right way. But I would just say spend your first couple of weeks just walking around the hospital, learning from your technicians.
Can I ask you a question relative to that? And I used to like whenever I would always carry a notebook with me. I know that's a little bit outdated now. Probably people have their iPads, but I would always, like when I was learning stuff, I would always just write down in a notebook and I would kind of follow up. I know different people have different levels of comfortability, how to do that. What did you do when you were learning? How did you make sure that what you heard out in the field, you captured it and went back and studied up on it? What mechanism did you use?
Yeah, absolutely the same thing. I have a notebook. I still have it. Of I would write down things when I didn't know,
Yeah.
like a word, or which was a lot.
Right.
But I would write it down and I would go back and research or ask someone that would know. Can you explain this to me? And I even had to have one of the technicians explain. I knew what a generator was, but I didn't know, all that it did and all the in and outs of it. So I had, my technicians explain to me how many generators we have and what all they hold and things like that. But just the same thing, I would write down questions that I had, and when I had free time I would go back and research them just in my notebook.
Yeah. Yeah. Because you don't want to pretend you know everything, because you don't, and nobody does.
I didn't. Yeah.
Nobody does.
No, I still don't.
Right. Right. Exactly. Jack, anything to bring up or anything we didn't cover?
I say it really is about there's a lot of things you're not going to know as new to facilities. Come into it with a humility. If you approach somebody, your peers and the people that you work with, whether it's somebody out, it could be a nursing manager or director, and don't come off as a know-it-all. If you're willing to learn, say, hey, I'm learning this, and I'll check. Know your resources.
Yeah.
So you got resources all around you. ASHI is a good resource for a lot of different things, but you're going to have other resources in your organization, maybe in your same hospital. Reach out to those people. It's okay to not know something.
Yeah.
And then keep in mind, you don't have to know everything to be able to manage things. So if you probably have a core set of knowledge and education that you can still apply those things even when you don't know something. And part of that is asking good questions. I've encouraged people to use the 5 why approach. You get to if you ask somebody that you don't understand the process or what's going on, if you ask them 5 questions of something you don't understand, at that point you will come to the truth of the matter. Even when people, you may have a staff member that's maybe not being totally genuine with you, and some don't seem right. Keep asking questions. Ask questions. You will eventually get to a situation, the understanding of a situation. And that's true whether you're trying to understand and problem solve for a particular issue, or if you're just trying to understand something you don't know. Ask good questions.
Yeah.
Be afraid to ask. Some people don't want to reveal their ignorance on an issue, but better to reveal your ignorance once than continue to live in ignorance, right?
Right. Yeah, because we all start
That's
in the
more
same
painful.
place. You're not. It's like tell my son all that he's a little bit younger. I'm like, you're not supposed to know the answer, right? You don't have to know the answer now. That's why you grow in your career and you do more. You don't come with the answers; they're not there.
Yes, indeed.
So this was a very productive session. I enjoyed this, and I thank you both for your time. But Taylor Vaughn from Children's down in Dallas, that works, right? Jack Evans from the Joint Commission, if you couldn't tell, up in northern Michigan. I thank you for your time. I look forward to doing a session 2. I appreciate you your knowledge and your time this morning.
Thank you. Thanks for having me.
Thank you.
My pleasure. This is Peter Martin from the Healthcare Facilities Network. As always, thank you for tuning into this episode. Have a great day.